Hi, this is Keith Bellinger again. I just want to do a brief demonstration of the capillary puncture. Capillary coming in either in the form of the finger stick or the heel stick. Finger stick for the adult or the medium-sized child, heel stick for the infant. Now first, when you're doing a finger stick, remember that you use primarily the first three fingers of the patient. Ideally speaking, you really don't want to use the thumb, and you really don't want to use the pinky. And when doing a finger stick, try to use it but by making a 90-degree angle or perpendicular stick, meaning that you go across the fingerprint. And when you look at the fingerprints, the grooves primarily go up and then down. In that point, you really want to go perpendicular or cut across it to make a T, as opposed to going parallel to it and going within the grooves. So at this point, I would open my alcohol pad and clean the tip of my finger. I'm going to use just the index fingers for demonstrative purposes. And at this point, you can allow it to air dry. Okay, once it's air dry, then you have your gauze in place just in case it's needed later. And you can gently massage the finger or use either heat of your hand or heating pad. In most cases, use the heat of the hand to help keep it warm. And use whatever needle device is given to you by your institution. And when you have to remember that the maximum depth of any kind of capillary puncture should be no more than 2.0 millimeters, meaning that it's just the depth of the blade, no more. So once you gently place it perpendicular to the fingerprint, at this point, with this particular blade, you would push down, but use these wing assemblies to pull back towards you. So you would briefly insert the needle, and once you do that and give a brief stick, you can discard the needle. And then at this point, once blood will be coming out, you wipe the first drop, because the first drop in theory will be contaminated with skin fluid, tissues, water, alcohol, things of that nature. So you wipe the first drop, and then at that point, then you would give a brief rhythmic squeeze. Rhythmic squeeze meaning that you would squeeze on a rhythm of every 10 to 15 seconds, as opposed to just excessive milking, because when you excessively milk it, you'll draw excess fluid, and that would override the blood and give you erroneous results. So at this point, you give a rhythmic squeeze for every, like, say, 10 to 15 seconds. Give a rhythmic squeeze. Allow it, since it's coming out perpendicular, allow the drop to form at the very tip of the tube. Once the drop falls in this scoop of the scoop cap of the tube, give it a brief tap against a solid surface like a table or something, allowing the blood to go to the bottom of the tube and proceed as normal. Every 10 to 15 seconds, give a rhythmic squeeze, catch the drop, and allow it to fall. And keep doing that until you obtain the desired amount of blood. Okay, once you obtain the desired amount, then what you can do is take your Band-Aid, gently but firmly place it over the finger. You can even add a little pressure to encourage to make sure to close the juncture. Thank the patient, and then continue on with your specimen to the lab.